name is Dr. Eric Olyejar, and I work at the Gilbert office at Ironwood Cancer Research Centers. Cervical cancer is not a very common disease. We see about 13,000 cases a year in the United States, which if you compare it to breast cancer, which is over 200,000 cases a year, but it is still the fourth leading cause of cancer in women. Very early stage, typically women don't have symptoms from cancer. So most women who are found at an early stage or a precancerous stage were found through a screening exam called a pap smear. Most women who have symptoms from cervical cancer have not had a screening exam or a pap smear in about 7 years. So most of these women present with heavy vaginal bleeding, bleeding in between periods, or periods that just continuously go on. Some women even will present with profound anemia, which is a loss of red blood cells from chronic bleeding. It clearly helps to be diagnosed as early as possible. In fact, women who get regular screening, it's thought that if every woman in the United States had regular screening, that being a pap smear once a year, we'd never see cervical cancer. We'd find it at a phase which is called dysplasia, which is the cells that are on their way to cancer but haven't formed a cancer yet, which can be treated very minimally invasive, and the cure rate is 100%. That being said, women who are found with early stage cervical cancer, like a stage 1A, have an excellent cure rate, over 95%. As the stage increases, the cure rate decreases. The first step is always to make sure that the cancer is either localized or know exactly how far that it spreads, so the treatment is appropriate so we can take care and treat of all the disease that's known. Typically involves having the patient see our team, the gynecological oncology team, which is a gynecologic oncology surgeon, a radiation oncologist, and a medical oncologist. The team then puts their heads together to form a plan which is best for the patient, which optimizes the best chance of cure with the lowest chance of side effects. One of the obvious advantages of being treated at Ironwood is that we're a comprehensive cancer center. We have gynecologic oncologists, who is a surgeon, radiation oncologist, and some of us, I've specialized in female care. We also have imaging capabilities right in the same center. It's a very curable disease, and again, the sooner we find it and the sooner we treat it, the better the chances are.